Hi, my name is Stephanie. I'm the clinical educator here at MRP. Today I'm going to show you how to set up your Bela MD. So next we're going to install our serums. The two I like to have on my machine is the Calm and the Bright. Your Bright is your antioxidant serum. Your Even is going to be for hyperpigmentation. Your Clear is going to have salicylic acid in it, so it's good for those oily, acneic clients. And then your Calm is going to be for hydration and those with sensitive skin. We have Deja, who is going to be getting a Bela signature facial, which is going to include a dry and wet microderm. We are also going to be doing a skin scrubber, microcurrent, and electroporation. Okay, first step is going to be our dry microderm. I've already prepped the client's skin with some alcohol prep pads. Now I'm going to take a look at her skin and see what grit size I want to use today. Remember, the lower the number, the higher the grit. So the 10 here is going to be the most aggressive, to where the 30 is going to be the least aggressive. So I've removed the safety cap, and now I'm going to put my microderm tip with the filter on there. So I'm going to choose the aqua peeling. It's on solution 1, but I'm actually going to turn the flow of that solution all the way off because I'm going to give her a dry microderm. And I'm going to start my vacuum at about halfway. So I'm going to hit start. I hear my machine or my vacuum turn on, and I'm just going to do one pass of this, and I'm also going to hold the skin taut. So I'm also going to look at her tissue response, and I'm going to ask her if she's comfortable with this setting. If I saw a lot of erythema, or if she's like, oh, that is really uncomfortable, I would turn my vacuum down. I've removed the microderm tip. Now I'm adding the small scaling tip, and these are one-time use. So you always want to start out on your hand to not only check the suction, but to make sure that the flow is going as well. And sometimes it'll take a minute to get through the tubing. I'm kind of gonna pulse down some of the fluid, and then I'm gonna go over the fluid and suck it up. Now I'm gonna go in with my skin scrubber, and I'm going to be using level 2. I'm going to be using the exfoliation side here to dislodge some of her impactions. And it's going to be using cavitation and ultrasound. On this one, you don't have to worry about the vacuum or the flow. This machine and distilled water is going to be doing all of the work. Okay, so for this mode, we're going to be using distilled water, and I'm just going to kind of use a sponge and press it into my zones. I don't want it really wet to where it's dripping, but I don't just want to wipe water on either. I'm going to be holding it this way to where the curve of the machine is actually going in a downward motion. If I were to turn it this way, I could infuse product using sonophoresis. Next step is the double lifting microcurrent. We're going to keep that at a level 4. We're still going to work in zones, but we're going to be brushing on some ultrasound gel. I like to apply it with a fan brush, and I just got my fan brush a little bit wet. And you just need a really thin layer. It doesn't need to be really thick. For this one, we also don't have any vacuum or flow. We will start at a level 4, and we'll just hit start. And then you'll notice as I rub this along her face that the balls will rotate in opposite directions. So I really want to work this muscle here. So I'm just going to kind of go back and forth in an X-shaped motion. I'm going to do that for a couple minutes. I'm also going to do a brow lift. So I'm going to go right under the arch of her brow, and I'm just going to kind of lift that skin and roll it all the way up into the hairline. And I'm also going to do that for just like a minute or two. I'm going to pull up the jaw and kind of give her a chiseled jaw appearance. I'm also going to go right under the cheekbone and kind of wiggle the tissue while pulling up under the cheekbone as well. So we're going to go back to the aqua peeling. We are going to be using the Bright serum on Deja today. So I'm going to keep it on solution 1. I'm going to turn up my vacuum just a little bit more than half, and I'm going to keep my flow a little bit under half. Hold the skin taut, and we're only going to do 1 pass of this, unless if we were going to combine it with serum 2, then we would do a second pass, but we'll just do this all over the face. Now I'm going to go in with my electroporation, so we're going to hit that. We're going to keep it at level 3. Once you hit start, you're going to notice that the red LED light comes on. To change that light, you're going to hit this button here, and it will change it to blue. Hit it one more time, and it'll do a combination of red and blue light, making a purple light. And then hit it one more time to turn it off. So we're going to today treat Deja with a red and a blue combination. Red light is mainly for anti-aging and product penetration, and blue light is antibacterial. So since she's dealing with some acne, I decided to do both lights. And so I put on the Be Pure Hyaluronic Acid Serum, and now I'm just gonna take this and go in little circles. It should feel like little pins and needles for Deja, but it should not be uncomfortable. How are you feeling? Okay. And how does this feel? I'm barely putting any pressure. I'm just kind of using the weight of the handpiece. And then I'm gonna work in each zone. I'm gonna break up her face into 4 zones. And I'm gonna do about 2.5 minutes in each zone. We're done with the treatment. Our patient has a little bit of erythema, but that'll go away by the end of the day. This is just gonna give her a nice little glow. We gave her a lot of exfoliation. We stimulated her muscles, gave her some ATP production, and we also infused her face with great ingredients from Bela MD.